Okay, good afternoon. Thank you for having me here today. This presentation is based on work conducted as part of my doctoral thesis, and I'd like to acknowledge the tremendous support of my supervisor, Dr. Ellen MacEachen, as well as the contributions of my committee members, Ivy Bourgeot, Carrie McCaney, and Bashak Yanner. So, today I'm going to talk about the experiences of self employed personal support workers. And I'll tell you about two different types of digital platforms that they are using to find work in Ontario. First, I'll share some context and what is known about the overall workforce, and then I'll describe my research study. So, personal support workers in Ontario work in hospitals, long term care, and in home care. They provide often intimate personal care and sometimes more complex medical tasks for vulnerable populations, while also being in precarious work circumstances themselves. Home care employees travel from person to person, although employees in long term care and hospital are usually trained for a specific location. Personal support workers, or PSWs, are a largely female workforce. They're comprised disproportionately of immigrant women and women of ethnic and racial minorities. They work in various sectors and settings, including private homes, retirement and nursing homes, and hospitals. Their jobs are usually part-time with low wages, and particularly in home care, they have inconsistent hours. PSWs in Ontario are not regulated, which means they have no professional, legal scope of practice. So we know more about PSW employees than we do about self-employed PSWs. PSW employees have clients who are part of the healthcare system. Their care needs are based on assessments by nurses. Home care PSWs who travel are often reimbursed in Ontario for mileage, although not the time. And all employers have statutory deductions from wages, and their employers carry liability insurance. In comparison, self employed personal support workers can have anyone as a client, and clients can technically request almost anything. Taxes or deductions are not made for self employed workers, they have to do that themselves. And we don't know whether or not they carry their own liability insurance. So, my PhD thesis focuses on digital labor platforms, which are online marketplaces where a worker offers a service and then a client or customer pays for that service. The platform work in general can be online like cloud work, or conducted by workers anywhere in the world, or it can be geographically tethered, like Uber driving or food delivery. So the work that I do focuses on the second type, the geographically tethered personal care work, where the location of the person is paramount. I look at these on-location platforms that were purpose-built exclusively for connecting care workers and care providers. And I found there were two subtypes: on-demand platforms, which are like Uber in many ways and provide um, an instant match, and marketplace platforms that have both jobs posted for workers to apply for and workers posting about their services. In the world of platform capitalism, there's been increasing awareness that these digital labor platforms, like Uber or Skip the Dishes, affect workers' occupational health. Therefore, I look specifically at the experiences of care providers who use those platforms to find in-person care work opportunities, to understand how the platforms also impact their work conditions. There we go. So years ago, I worked briefly as a personal support worker myself. And then for a dozen years, I worked in a healthcare organization where PSWs were part of the care team. I experienced firsthand that the occupation is undervalued and not formally organized as a profession. Literature also tells us there's inconsistent education, there's diverse job duties and titles, and employment settings. There are limited data about the PSWs who are employees, and very little is known about the PSWs who are self-employed. Based on that, you can guess there's almost nothing known about the self-employed gig workforce that uses digital labor platforms. So the overarching aim of my PhD research is to better understand the experiences of these self-employed PSWs who use these platforms to find jobs or try to find jobs. I set very specific inclusion criteria to ensure that I recruited women who use digital labor platforms that, again, were purpose-built for care provision and arranging care work, and who did this with the status of independent contractor, making them self-employed. For this PhD study, I conducted 32 in-depth video interviews. I spoke with 20 gig care workers who were all women using digital labor platforms for care work in Ontario, and 12 industry informants. And they had a range of expertise, including digital platform owners, managers, and app developers, as well as individuals who used the labor platforms to hire workers for themselves or worked in hospitals and long-term care homes that hired the workers. There ended up being, as I mentioned, two relevant types of digital labor platform, the marketplace model and the on-demand model. And I'll talk a little bit about those differences shortly. In the interviews, some of the workers agreed to show me how they used the platforms, and a few sent screenshots. All the interviews were audio recorded, transcribed, and independently coded by myself and another graduate student. I used institutional ethnography to explore the platform functions and then the resulting practices of the workers. So this study draws a little bit on findings from a recent paper that I just published in June. So that's the information for that. So before I get into the findings, this is a quick description of the sample. And you can see in the right-hand column the app type that the platform workers used. 12 workers used the marketplace apps to find or try to find work. And you can see also how many jobs they had. And the marketplace workers found work in private homes for individuals. 8 workers used on-demand apps, and those were to find shifts in long-term care or hospitals. Overall, many of their job conditions were similar to other gig workers. There was no workers' compensation. However, we learned that this also means that companies are liable for workplace injuries, and some of the companies weren't aware that gig workers were not temporary employment agency workers. And there is a distinct difference there in Ontario because temporary employment agency workers have some coverage. Without that, one company was actually sued by a worker because there was no fault insurance to protect them. So we found some gig home care workers do not report their income, which makes them vulnerable to being detected for tax evasion. And all these personal care workers found there was a lack of opportunity on the platforms. The marketplace workers also faced elevated risk because they were going into private homes. And I'll primarily focus on this final point for the remainder of the presentation. So gig care workers were independent contractors. They travel from location to location, with on-demand workers finding shifts at hospital or long-term care, and marketplace workers being hired in private homes by individuals needing care. Workers use digital platforms to try to find jobs in these different settings in the geographic areas near them. But there were also differences between the two types of platform. On-demand workers use the platforms to find the shifts at the companies they preferred or for job descriptions that they preferred. For example, some people looked for something called constant observation shifts, where they only had to work with one patient, observing that patient. And they spoke about wanting that instead of floor duty because they weren't familiar or oriented to the site. They also found there was a lack of opportunity to work whenever they chose, which casts doubt on the so-called flexibility that platforms advertise. All the workers in this study spoke about liability and precarious aspects of the gig work, like unreliable income and platform work conditions. This chart looks at occupational risks and how they differ for marketplace and on-demand platforms. So gig caregiving workers were required to submit personal information when they were on the marketplace apps to meet membership requirements of the platforms. But they didn't always have information about the clients that they were going to meet or go to. And this created an information imbalance that the technology set up within the structure of the platform. And this is especially concerning for home care workers going to client homes to meet strangers and provide probably relatively intimate personal care. For all workers, there was a lack of orientation and training. And there was also job competition and scarce opportunity. As independent contractors, gig workers had no guaranteed work, but some marketplace workers paid membership fees to use the apps. In on-demand platforms, there was pressure to act quickly and accept posted jobs. Some marketplace workers evaded taxes and worked under the table, discussing that they couldn't afford the cost of living and needed the cash jobs. Altogether, this model of personal care work results in the degradation of an already precarious occupation. The way that the marketplace labor platforms operate, connecting individuals needing care in their private homes to unregulated workers, is by capitalizing on what is sometimes referred to in Ontario as a Wild West in healthcare. This is because there is little regulation in the home and community care sector. For employees of home care organizations, there's a liability coverage within their jobs. However, for gig care workers, they can legally perform some tasks considered medically complex, while potentially being held liable for adverse outcomes. So Joyce saw this as an advantage that she considered she could do certain tasks like give insulin injections. And she said if she was an employee, the policies of her company would prevent her from doing things like that, even cutting clients' nails. But as an independent contractor, she thought she was more enabled to perform those tasks. There was little recognition of the potential liability issues associated with that. The nature of using apps also introduces some risk for workers who put the information about themselves on an app. Now, the app information wasn't public. You had to sign up to be able to view the workers' profiles or services that they were offered. And in fact, in another story, that is a process that I undertook as part of my recruitment, was joining digital platforms for recruitment. Even though, so you can see what information is available there. And even I was able to assume a name and reach out to contact gig care workers who had their information on digital labor platforms. Some marketplace workers talked about going to private homes to provide care. Most recognized the risk involved, and they often arranged their first meetings in public, in locations such as coffee shops. But there was a tacit acceptance that a certain level of risk was in the nature of the job. Ifioma, for example, said, you know, knowing name and image is not enough to know if you're comfortable working with the person. You have to get somewhere, but maybe if you get there and you've not met them first, and maybe the house is scary to you. I mentioned there's pressure for on-demand workers to make rapid decisions. And this is because there were many more workers that were interested in the jobs that were posted than there were jobs. And workers perceived this as a scarcity of jobs, although the platforms certainly benefited from having an excess of workers. Um, for the workers, it came across as it being competitive. And Amara put this very succinctly: the fastest finger gets the job. Although there were not a lot of jobs available, workers using on-demand apps to find shifts in hospital or long-term care were still selective. Okay. They regularly only applied to shifts with certain types of duties, for example, patient monitoring. And they also found some locations were much better than others. Beth, for example, talked about wanting to work in one location that was a good environment. There was a lack of orientation, though, overall, and that introduces risk for workers who are going to new sites where they're unfamiliar with the location. Liba put that as such: there's no guidance, no orientation. At other hospitals, they orient you for at least 2 days, but for the platform, nothing. They just put you on the spot. So overall, workers encountered specific risk working as gig care workers. There was liability for care work tasks. There was risk of injury and harm. There was some lack of choice and flexibility. And there was an information imbalance and unknown clientele. And seeing that these two types of digital platforms were used for different healthcare settings also highlighted that there were different job conditions and risks for workers. In care work in Ontario, it was previously known that home care workers have lower wages and more variable shifts. The key finding here is that the different platform types exacerbated prior inequity in job quality between the home care setting and the long-term care in hospitals. And that makes home care jobs worse compared to hospital and long-term care in gig work as well. Um, Key takeaways for this: the digital platforms are part of organizing key care work. They operate differently in different healthcare settings, and marketplace home care workers face more concerning safety risks than the on-demand workers who are in institutions, hospitals, long-term care. And that's my presentation today. Thank you.